Hey guys, in this episode, we're going to talk about one of the most fundamental nutrients that the body needs for a healthy immune system, okay? And by the way, my name's Dr. Jere Mills with Mills Wellness Center. We're doing this series on immune health, um, and we're taking little bite-sized topics. And today we're going to talk about probably one of the most overlooked early pieces that we actually need. I used to do a class a number of years ago, and I would kind of lead patients in a direction, and I'd ask, what is the most essential nutrient in the body? And usually I'd kind of lead them, get them thinking in this direction, but most everybody would say food, right? We need food and we need the micronutrients and things like that that we get from food. And I'd say, no, we can probably live about 40 days at least without food if we have to. There's something more essential than that. Of course, everybody'd say water. Yeah, you're right. Water's probably more essential than food. We could only live a few days without hydration, and we'll talk about that. Um, but I said there's even more essential nutrient. And everybody would think for a second, and they'd come back and say oxygen. I'd be like, yeah, you're right. We do need oxygen uh, in order to live, but there's something even more important than that. And of course, this is where I would get to jump in and save the day, right? It's our uh, neurological activation. So you can live a, a month or more without food. You can live a few days without water. You can live a few minutes without oxygen. You can't live a millisecond without neurological activation, right? If the brain shuts down, nothing's coming back, okay? And so that's usually where we lead into the importance of the nervous system. However, we talked a little bit about mental health, and we will come back to it, but mental health plays a real big role into the next nutrient we're going to talk about, oxygen. Um, and so oxygen and the immune system go hand in hand. You know, one of the things that happens, and we talked about this in one of our previous episodes, is when we're under stress, right? It kicks us into this fight or flight response. And somewhere along the way, as we go from a baby to an adult, oftentimes we experience stress. And when we experience stress, we have a tendency to breathe what we call paradoxical breathing, or breathe from our shoulders instead of from our diaphragm, right? And so in order to get more breath, we expand the lungs, we raise the shoulders, we get our shoulders up into our ears, which, by the way, from a chiropractic standpoint, is one of the big reasons that so many people we see with headaches, is that they've lost the ability to breathe correctly. And so we have to start all the way back there. But breathing, when we're under stress, and most people are under chronic stress, and so they've actually forgotten how to breathe correctly, and so they're not getting good oxygen exchange. They're only breathing from their upper lungs. And another thing is when we're sitting, it's harder to use our diaphragm, and so when we're sitting and we're under stress, it's harder to use the diaphragm. We start using the shoulders because of stress, and so we get this really poor exchange of oxygen and air. So not only does it lead to obviously musculoskeletal problems, but it starts to deprive the body of the oxygen that it needs when we're breathing incorrectly. A lot of times in practice, as I think all doctors, we tend to sometimes get lost in the weeds and forget to see the forest, or however that saying goes, right? But we get lost in too many details, and a lot of times when there's a case that's kind of stumping me, or a problem I'm trying to figure out with the patient, I usually go back to just the basics. And so I kind of ask myself, what does a cell need in order to be healthy? Well, it really only needs two things. It needs stimulation, positive stimulation, and less negative stimulation. But it needs stimulation, and it needs nutrition. Well, what's one of the most essential nutrients that we need? Stimulation, neurological, but also we need food. And one of the foundational foods that the cell needs is oxygen. Certain cells can live a longer period of time without oxygen than others, but they all need oxygen. And when we're not getting good oxygen exchange, because we've got this bad breathing pattern that's developed, it can really lead to some prolonged problems. The interesting thing about breathing, when we look at deep breathing or diaphragmatic breathing, it's one way that we can actually reset the stress responses that we often get into. So again, when we're under sympathetic stress, we're getting ready to fight or flight something, we're going to run really fast away. We need to get a lot of oxygen into our body. so that we can run. And so the body expands like this. But when we're sitting all the time and we're experiencing the stress in this unnatural position, that expansion doesn't occur much from the diaphragm. It basically only occurs at the shoulders, and which actually tends to create even more stress on the body, right? Whether it's muscle pain or just a lack of oxygen, which creates more dysfunctional breathing, which creates more stress on the body. And so we kind of start this bad cycle. One of the ways to breaking that cycle is to simply just, like I said, just look at breathing. One of the interesting studies that I'd come across a number of years ago. They looked at deep breathing with cancer patients, and what they found is patients that focused on deep breathing, breathing from their diaphragm, breathing correctly, actually improved their natural killer cells by like 3 to 4%. So that's a pretty big jump. And natural killer cells are our first line of defense against any virus or pathogen that we experience. So it's really important to strengthen those for our immune system. The other effects that it has is it lowers the cortisol, it lowers our blood pressure, it re-regulates us away from that sympathetic dominance to a more parasympathetic dominance, which is where the immune system really lives, right? We talked about that previously. And it helps with pretty much every cell function inside of the body. Again, it's a great way to just kind of reset the nervous system, if you will. So how do you practice breathing? Well, when you take a deep breath, I want you to assess your breathing. So one of the easiest ways to do it when you're first learning to retrain yourself is to lay on your back. Laying on your back kind of anchors your shoulders, which actually forces you to use your diaphragm a bit more. Whereas sitting is often a challenge for most people, so it's usually easier to breathe laying down and then standing and then sitting. Now I'm going to train you while sitting, and I assume most of you are watching this sitting. But what I want you to do is put a hand on your chest and a hand on your tummy. I want you to take a deep breath in. Now, if you feel your chest moving up like this, that is incorrect breathing. The other thing is you may notice if your tummy goes in when you take a deep breath, that is actually paradoxical breathing. That is actually the worst type of breathing. So if the tummy doesn't move but the chest goes up, you're a shoulder breather. That's a problem. We need to address that. There's some that believe that breathing dysfunction is actually one of the primary underlying causes to most musculoskeletal problems, but also many diseases too. So anyway, that is a side note. So sorry. Um, so when we take a deep breath in, what should happen is that we should feel our diaphragm, our tummy muscles move out. As the diaphragm moves down, that brings oxygen all the way down into the bottom part of our lungs, right? And then as we let the air out, we feel the diaphragm come up. As our tummy goes back in, that pushes the oxygen out from the bottom parts of our lungs so that we get that good, deep, full oxygen exchange all the way up and down. I know we're talking a lot about this with immunity and with the pandemic and everything else that we got going on, but this is so great as we get older, because a lot of times as we get older, we're sitting a lot more and we're not clearing the bottom part of our lung. That's where pneumonia tends to sit in. And this is one way of maybe trying to head off some pneumonia and some other respiratory problems that may be headed our way. Um, Now, one of the other things that is common with breathing dysfunction is postural distortions, right? We sit too much time sitting, we fold up like this. When you fold up like this, you cannot move your diaphragm. Go ahead and try it. Slouch down, try to breathe from your tummy. Like, it is very, very difficult. You got to have really good control when you do that. And so what I want you to do is just stop for a second, assess your breathing. If you sit at a computer, you need to be assessing your breathing every 30 minutes or so. Remind yourself, get your shoulders up, get your head up. Don't be slouching and doing this all the time, right? So today's episode was somewhat elementary. We started with just breathing, right? But I hope that you got something from it. I hope that you get something that you can take from it. Um, Certainly, not necessarily hype in chiropractic in these things, although there are a lot of applications of chiropractic. When we talk about postural distortions, by the way, if you're in this position all the time, your body adapts and molds to that. And exercise and trying to open everything back up is one of the big things that we would do. As a chiropractor, sometimes you get joints that are stuck. That's where we come in. So that's why we do a lot of postural re-education programs in our office, to really address that. And I think one of the big benefits, yeah, it's good to have nice posture. It's good to do that. I personally think one of the big benefits, though, is that it helps people breathe better again. And so maybe simply changing their posture, maybe a lot of the health benefits they get is because they're breathing. So, anyway, hope you like this episode. Again, like us on Facebook, like us on YouTube. Tell your friends if you're getting something from this. And so until next time, stay healthy and stay well.